and Joe asked me to present something on health and safety issues as related to artisanal small-scale miners, especially in Malawi. So the first slide shows the definition of artisanal, who is an artisanal small-scale miner. I think somebody must have done his geostatistics to come up with the figure of if something is mined not less than 50,000 tons of material. Okay, it's 50,000 tons of material or less. It was defined a unit that is equitable to an artisanal small-scale miner. So, by definition, I think collectively, you can see that you can group all the characteristics into one to come up with a definition that we cannot quantify. So, as already alluded to my friends like Charles, the characteristics of artisanal small-scale miners, among others, you can see it's informal and illegal. As the director of mines yesterday, there's some sort of debate between informal and illegal. They might be used interchangeably. So, in other ways, in short, you can say it's not regulated by the government. The other one, it's undercapitalized. Mostly, ASM is poverty-driven, so it's done mostly by the poor people. However, in Malawi, there's some sort of a paradigm shift because we have seen that most of the Malawians are being used as laborers by other people from outside. I can say foreigners are using most Malawians to dig for them. So, in that essence, undercapitalization sometimes is debatable in our case, since mining in Malawi it's at infancy. It also uses or utilizes simple tools like hoes, shovels, of course with some sort of reservation. I think it was highlighted that whenever you want to use mechanization, there are some steps that you're supposed to follow, but mostly ASM is done using the simple tools, and it also lacks technology because mostly use hands. Partially is mechanized. That's why we are saying it's lacking in technology. The other point is ASM is very hazardous. It's hazardous, and it happens under intensive conditions. If you have been to most areas where ASM is taking place, mostly it's the women and children that are used in the digging and also the whole process of ore processing, milling, and some sort of organizations in assistance to the male counterpart who happens to be the father or the head of the family. So that's why we are saying it's labor intensive because mostly you use others to work for you to minimize the cost. It's archaic, and the extraction method, it leads to adverse effects and the consequences on the environment. This presentation, we cannot talk of health and safety and forgetting environment. So mostly it's the environment, health and safety, or some people they call it safety, health and environment. Others they call it occupational safety, health and environment. So you can see that on my presentation, some of the issues have been highlighted by Charles because the environment is also included in the health and safety. What are the trends of artisanal small-scale mining in Malawi? I think this will partly answer the question that was raised. Somebody was referring to Congo, where they have over 1 million ASM. But in Malawi, you can see that we have said the trend has grown recently considerably. I think some other reasons are the gold rush that we have at the moment. So by 2016, it was estimated that we have 25,000 artisanal small-scale miners. And by 2018, it was 40,000 ASM or more. This statistics was given at a presentation on a global extractive industry review by Professor Nelly Mutemeri from South Africa. He's the one who did some sort of a project on ASM in Malawi. So these figures are coming from her acknowledgements. So in short, as we stand now, we have almost 40,000 or more. The more is coming because of the recent gold rush from 2016 up to the present. It has got the potential to limit rural-urban migration. Because of economic activities that are taking place in the remote village areas, and you have the bargaining power so that it is limiting people to move from the village to the town. In other words, there's some sort of temporary urbanization that is created. As a result, there is no shift of people from the village to towns, thereby also controlling overpopulation and overcrowding. Let's look at the risk factors that are related to health and safety in Malawi. Since ASM is done illegally, it is not controlled. One, there is non-compliance to safety standards. ASM is done randomly, so there is no compliance to health standards, as it written. There is lack of enforcement of mine safety requirements, awareness of other inherent mining, other risks in inherent mining. What we're trying to say here is when you are doing artisanal small-scale mining, you are exposed, the risk is very much higher because you don't follow the regulations that are set up by the government. So that's why we are saying it's inherent in mining. There is lack of access to better equipment. Most artisanal small-scale miners, they don't put on PPE when they are working. From the studies done previously, it has been said that in the SADC region, Malawi is deficient in mainly among the most important risks and hazards that are in ASM mining. One is the unsafe acts and the lack of access to personal protective equipment. So as you can see, most miners, even from the previous pictures, you can see that most miners, they don't put on PPE. So that is a very big risk and hazard to the person. There are poor working conditions, that much we know. There is a lack of reporting mechanisms. Most of the instances and the accidents or injuries, they are not reported to the ministry or to the labor office. It's when there is an alarm that some of the instances are reported, but mostly they are not reported. So let's look at the negative effects of artisanal small-scale mining in Malawi. On that one, I will not say much because they have been highlighted previously by Charles. But to just pass on, ASM in terms of environment, the miner is exposed to harmful effects, both physical, chemical, biological, and economic hazards. There's a contamination of large areas through water runoff and also improper waste disposal. There's erosion of mining sites, mercury contamination or toxic chemicals. Of course, on the mercury contamination, in Malawi, I think we are not yet much there because the amalgamation is not done yet, where you have expansion of the cyanide, that is a heavy risk and a heavy hazard. There's the situation of rivers and pollution, thereby affecting the hydrogeology, that's groundwater. Destructions of sensitive areas like the geoheritage sites, the graveyards, and what have you. And also we have said the poor waste management practices. There's also washing away of dust particles and fines. Mainly the particulates, they are transported from the mining area and the effluents might be deposited into the nearby streams and creeks, thereby affecting the lower areas. It has the potential to change the hydrogeology and water quality. This one is saying particularly increased turbidity. The clearing of riparian vegetation, this one I think it enhances the erosion we have already said and the situation. There's also unregulated sewage from the camps. Litter is just thrown anywhere. There's no control mechanisms that is put in place, so that is a health hazard. What about health? In health, we looked at the women and children who suffer mostly, and they are exposed to toxic substances that can in the long run lead to neurological damage. In the case of women and children, for those of you who have been to the mining sites, you will discover that the family entity is transferred from the home to the mine site. Because you see, even at the mine, the woman will still carry the tasks that she carries at home. She cooks for the father, she gets firewood, she does this, she goes collect water. So it's mostly the women and children. And most of the times, children are used to dig in the pits. For example, I went to one of the mine sites where ASM is carried out. I found school-going children digging for the foreigners. I felt very, very embarrassed on that one. So you can see almost throughout the day, they are used to dig the ore, bringing it to the surface. So that's why we are on health. The health risks and hazards to women and men is higher than the owner of the selected mining area. Dust accumulation leading to dust-prone diseases like silicosis, asthma, almost some of the lung diseases like tuberculosis. So there's also increased waterborne diseases. We have seen at examples whereby when you're mining, you leave those hollows. They can be breeding grounds for mosquitoes and some other waterborne diseases. There might be serious injuries and death due to collapse of pits. I think Charles showed us something from Zimbabwe where you have that big overburden being scrapped to a depth of about 50 meters. When somebody is mining down, the walls can collapse. So that becomes a health hazard. An increase of instances of, mostly we are talking of substance abuse, where you have different people from cross-cultural differences. You expect the behavior even to change. So they are indulged in some of the activities that are abusing their life. So it becomes a health hazard. There is a greater risk of violence, transmission of STIs, and what have you. On safety, we have said there is lack of PPE. A lot of injuries that are arising from accidents and incidences, unsafe acts and conditions, and non-compliance. This non-compliance is, since we are saying ASM is unregulated, there is some sort of a mechanism that is lacking that will be passed on to the ASM. That's why we are just saying that they lack compliance. But we're supposed to go to them and tell them that they have to comply. So it's the duty of the government departments to enforce the regulations of the artisanal small-scale miners. Okay, what are the impacts of ASM to children? There's child destitution leading to school dropout. It was already highlighted. Others, they call it gangsterism, violence, and drug abuse, already highlighted. But this one is specific on children. Prostitution that leads to transmission of diseases. And overall, child labor leads to a lot of health risks. What about women? The impacts on women, as already highlighted, there is a risk of chemical hazards. Because overall, in a mine site, in the artisanal small-scale mining site, you see that the women are the ones who are taking most of the part in ore processing, even grinding. Okay, so there's a high risk of getting contaminated in terms of health. There are severe complications of health and well-being, especially when women are pregnant. It poses a health hazard because by the end of the day, you might contaminate the inborn child. Exposure to crime, domestic violence, and rape. We have also highlighted the same thing. We are having people from different cultures, so to mix that culture blended into one is very difficult. So each one comes with his own culture. So it's chaotic. The situation becomes uncontrollable. Affected by degradation of environment through food, firewood. We have already highlighted this one, the duties of a woman or a mother in a artisanal small-scale mining. Okay, what are the statutes that are supposed to regulate, or they regulate, the health and safety environment in Malawi, but not necessarily may be applied to artisanal small-scale mining. So we have all those statutes that you can see. We have the Occupational Safety, Health and Welfare Act, the Artisanal and Small-Scale Mining Policy. This one has just been implemented, I think, should be this year, if I'm not mistaken. The Mines and Minerals Act, this one is under parliamentary review, something like that. Of course, we are still using the 1981. The Malawi Constitution, the Environmental and Management Act of 1996, Explosives Act 1968, Public Health, Road Traffic, Workers' Compensation, Labor Relations Act, and Employment Act. All these statutes, they are the ones that regulate the mining industry in Malawi in terms of health and safety, though not necessarily applied in artisanal small-scale mining because of the illegal nature. Okay, after having collected all this information, what's the way forward for us in terms of health and safety in artisanal small-scale miners? Officials from the government departments are encouraged to give training materials in terms of health and safety to the artisanal small-scale miners. The mechanism, we are yet to discuss. What could be the mechanism? We have to instill a safety culture through advocacy, sensitization, and outreach. An example was given yesterday by the Director of Mines that they had some public address system to move in the gold rush areas where people could be sensitized. Enforcement of operating standards, the use of personal protective equipment, hazard control methods, method statements or procedures, all these can be incorporated into the ASM to make it a conducive environment. There's need for frequent monitoring and inspection. This one is from the government side, because the government is the body that regulates the laws from the statutes. There's need to have frequent monitoring and inspection. The other one is the use of police. The police and the army, they have got the power to sanction. We have got a living example where the police went to Mangochi to stop artisanal small-scale miners operating because it was done illegally. So what we are saying here, the police should have the power to sanction, because without involving the police, chaos will still continue. Enact specific regulations that will address health and safety issues. In Malawi, issues of occupational health, safety and environment, they are almost new, both in the mining and the infrastructure development. We have not been used to health and safety issues until some 3-4 years, when most companies were requested to include the environmental health and safety plan in mainstreaming of into the mainstreaming of the agenda. That's when now health and safety issues are coming into interplay. Thank you very much. That's the end of my presentation.